Namaste and welcome back to the conjunction of psychoanalysis and homeopathy. So far in part one, we covered what homeopathy is about, how the remedy selection is done. Somewhere we were in a very fascinating and interesting revolution of periodic table with a touch of psychoanalysis here. So welcome, sir.
Namaste.
To continue with the discussion further, it brings the periodic table into the modus operandi of homeopathy. Can we have a touch of psychoanalysis there?
Definitely we can. I'll do it with an example, but let me just first make a statement that the moment we move away from a pure repertory and materia medica based approach, we are essentially moving into some sort of typology.
Okay.
That we are classifying the universe of the patients into some groups based on criteria, which we believe, or let me say the doctors believe, will help them prescribe better. So essentially, we are dealing in an exercise of typology. And when you get into a typology, all the benefits and the risks of typology, they also come in. I will not go into it today, the generic discussion on any typology for that matter. But today what we'll do is, let me take up with this opening remark, the typology that some homeopaths use, that of dividing patients into kingdoms, mineral, plant, and animal, and using that to prescribe, find the right remedy. So the idea there is that the core problem, if you divide people into three, minerals, plant, and animals, patients who fall in the mineral category, the core problem in them is that of a structure. And from psychoanalytic point of view, we would call it the problems of formation of the structural components and the problem, ego and superego, and the problems of formation of the self, and the problem of individuation and separation. So if you use Mahler's words, we are looking at fusion individuation phenomena. That there is one pull between the child and the mother which wants them to fuse, and another force which wants them to separate and individuate. So separation is necessary for individuation, and both the forces are forces of nature. That there is a force to fuse and a force to individuate and separate. And over a period of age, the first few months, initially the fusion is strong and then the individuation force is strong.
Excuse me.
That does not mean anything goes zero at any point in time in life. But from Mahler's point of view, we are looking at fusion individuation problems. From the point of view of formation of I and not I, we are looking at I and not I formation problems. From point of view of code, we are looking at the self-formation problems. From the point of view of Freud, we are looking at the ego, superego, structural formation problems and the functional formation problems, the functional balancing problems. So, the core of the mineral patient is that of the structure. That something is wrong in the structure at a deepest level, and therefore the sickness that you see on the surface. So that fact is used to find a remedy. That if somebody is classified as a mineral patient, the core problem will be that of a structure. Similarly, if some patient is classified as a plant, then the core problem will be that of sensitivity. The core problem will be sensitivity and disproportionate response. And if somebody is classified as an animal, the core problem at the root will be of survival, will be of strife, will be of competition, will be of adaptation, and so on. So if you look at it psychoanalytically, we are looking at the mineral kingdom as problems which emanate from fusion individuation issues, from structural balancing issues, from self-formation issues, and from I not I issues. From our point of view, that is how we will describe the mineral kingdom. When we look at the plant kingdom psychoanalytically, we would call it like them the sensitivity problem, but we would use a separate term. We would add it by calling it an affect generation problem. That the affect generated is too high, and then it's an affect regulation problem. That the response is disproportionately high because of very high sensitivity and inability to regulate the high affect generated once generated.
Basically, the fragile one.
Fragile, correct. In our language, it would be the fragile group. The plant group will be the fragile group. In fact, the mineral group also will be the fragile group in a separate sense.
Okay, exactly.
In fact, the
it's nothing to do with the effect, it is to do with the constitution.
Yeah, in some sense, the plant, we can still use the word delicate, but in mineral, because it's a more basic level
Fundamental.
self-formation, actually it's even more fragile.
Vulnerable.
Some of the minerals from a therapy point of view will be more fragile than even the plant. Because in the plant, there may be a mechanism of adequate release because they don't have the mineral basic problem of I formation, the self formation.
Right.
They have a problem of self-functioning at a very elemental level. Whereas the animals will have the problem of self-functioning at a macro level.
Macro level.
So this is how we would, and the animal kingdom difficulties we would look at as essentially difficulties of survival and of the Oedipal nature. Because it's the man going out into the society. So if you look at it from this point of view, that you can divide reality into the matter, life, and mind, then you have the mineral, the plant, and the animal.
It is also to do with the phases of the development of the structure of the mind, where the Oedipus takes place later. Correct. Comparatively, where you are already the I faulty or the healthy is established, the other is established. Now the competitive environment also comes into the role play.
In our case, the difference will be the sensitivity is involved both in I formation as well as in dealing with the society.
Yes.
So instead of putting mineral, plant, and animal, we would have to put plant, mineral, and animal in terms of the operational elemental process.
Absolutely right.
In macro terms, you can put it anyway, but in elemental terms, it will go that way. So coming to the periodic table, the first row, hydrogen and helium, in that view, if you give this to a person, he feels as though he does not exist. He's completely unacknowledged by everybody. It's a kind of an absolute abandonment. That a man is sitting in, let us say, a theater, in a park, let us say, everybody comes and goes, nobody says hello to him. As though he does not exist. Now, this is the first line, hydrogen and helium. And therefore, when you have problems of this type, that a man feels completely, absolutely rejected and abandoned by everybody, just not, as though he does not even exist, that nobody even acknowledges my existence. So his first problem is, please acknowledge my existence. Then in such cases, hydrogen and helium based remedies, they work. Now,
just to add on, there is, I'm just getting in touch with something. Nowadays, functional medicine has talked about treatment with hydrogen molecule. It's very similar to what you're saying.
Correct.
There's a treatment in which you take hydrogen molecule, just the hydrogen molecule in the direct form. It helps you with a lot of existential crisis.
Correct. So we don't know whether in the macro form it's doing the same action as in the potentialized form.
Potentialized form.
But what is interesting here is this, that if you say that the first row is for somebody struggling to have his existence acknowledged,
Right.
Psychoanalytic point of view, this would be the first A of Cohut. When Cohut
Mm.
mirroring failure, he uses 5 A's to describe the mirroring failure. The first is acknowledgement, second is attention, third is acceptance, fourth is affection, and the fifth is admiration. The 5 A's of mirroring, how the world mirrors you, and how each of them can go wrong and result in a faulty self-formation. And this again brings us that the mineral kingdom has to do with self-formation. Sorry. So the mineral kingdom has to do with self-formation, fusion individuation issues, I not I issues, boundary issues, I am good enough issues. And this is where I will also bring in the valley junction model of mind, but later slightly. So let us say the first row. Now the first row precisely deals with what Kohut would say are the acknowledgement issues, the first A of the mirroring failure. Now some people may not be so unfortunate that their existence is not acknowledged by the caregivers, but they may be unfortunate enough not to get adequate attention. So they will not have a problem of acknowledgement, they will have a problem of attention. Some will be even slightly more fortunate, they will have adequate acknowledgement and attention, they will not have attention. Some will have all the three but not have affection. Some will have all the four but not have admiration. So at any level, the mirroring failure can happen. Now, from this point of view, we say that the first row then deals with the Kohut's first problem of acknowledgement. The second row deals with Mahler's problem of fusion. The child just can't separate. The forces of individuation are not strong enough to counter the forces of fusion. And the child remains fused. The third is of extreme dependence. That's almost like a dependent personality disorder. The third row of the periodic table, that brings out dependence. And the fourth brings out identity and something else. So
Row you're talking about, not the columns.
no. Now this is the row part. Now the column part is that the column indicates the continuum.
Okay.
That on one hand, let us say somebody has an acknowledgement issue, let us say the attention, the fusion issue, extreme will be row 2, column 1. And then as we move along, the intensity intensity reduces.
Decreases.
So the columns sort of, they create a continuum. At the two ends, they are the two ends of the continuum and all the shades in between. Now, this is very important for us because if we look at the third column of dependency, each column will give us a subtype of dependent personality disorder. That all of them are dependent, but different shades of intensity and with different characteristics. And the moment you take that substance, you can list out the characteristics. And this helps us to tally with our knowledge of dependent personality disorder, that how have we developed the typology, how many subgroups we have created, are they more or less? If they are more, then what the periodic table suggests, they can learn from us, and if they are less, then we can learn from them and incorporate those subgroups in our learning of dependent personality disorder. Similarly, it can go on. So you can use the psychoanalytic concepts to the periodic table, and someday we will do it in details. Just the periodic concepts and the psychoanalytic periodic table and the psychoanalytic concepts from this homeopathic standpoint, that how we can psychoanalytically explain each row and column, which homeopaths do in a different way. And it would be interesting to see the compare, contrast, and the mutual enhancing by this exercise. I think it will be a very fruitful exercise. So it will be very interesting to see how we can apply psychoanalysis and use a different metaphor to describe the same periodic table. than that of the birth and going out, birthing and going out, which traditionally is used in homeopathy.
How about then other kingdoms?
Just one point before you go to the other kingdoms. It's very interesting to note that the inert gases,
Oh my God.
the noble elements, so to say, they produce very different effects.
I
And
get where you're going.
I'm sure some of them will be linked to autism in some way or the other. Autism, catatonia, regression to primary narcissism, all those extreme withdrawal cases where I
Hmm.
don't feel like interacting with the world,
Inertia sets in.
descent into inertia, complete descent into inertia, complete capture by the death instinct in Freud's terms. All of those will have something to do with those. Uh,
Inert noble gases.
yeah. And even the hypodrives, somebody not having adequate drives, not pathological. He's a normal person, but the drive is not adequate.
Awesome.
Just the man is too noble. And we want him to be less noble and more normal.
More worldly.
So, coming to your question, uh, the other kingdoms, the plant kingdoms essentially deals with sensitivity and hyper response. And just as you have different plants, when you look at them and you see their behavior, you develop an understanding as to what the plant stands for. What is the main characteristic? And based upon that genus understanding, you try to dilute it and form a remedy and see if it produces the same thing. And usually it does. Now, this creates a very important problem from a philosophical standpoint, that out of so many characteristics of the plant, when a human being looks at it, he focuses on certain things. So
Mm.
what we understand of the plant as its essence is nothing more than a human summary, a very subjective summary of what all the plant is about. The question would be, let us say a touch me not plant is seen by a human being and he understands in a particular way. How would a rat or a cat understand the same plant if they look at the same plant? Does it create the same thing in them or different things in them? And let us say if that plant heals problem X in us, does it heal the same problem in plants and animals, or does it work differently? Or is it that the way the species sees and understands the plant, the same way the plant works on them? Maybe this is
Like in many cases, there are many animals and plants which are worshipped in certain culture, rather in other cultures, they have been considered as evil. That means they must have perceived something out of it which has changed the dynamic with that existence.
correct. And this also brings to the way the plant animals select their own remedies in the wild.
Right.
That instinctively they know what to eat in a particular given situation.
Situation.
That would depend on the way the species subjectively looks at the plant,
Perceives.
perceives the plant. So is it that nature has put into us a unique way of perceiving, and the said remedy works in that particular way in us and maybe differently in different species? Or is it that the way human beings perceive it, it acts the same way across animals and plants? I don't have an answer to this question. I don't even know if there is a generalized answer to this question, or we may only
But
have particular
I'm coming in touch.
plants and
I'm
animals.
coming in touch. Yes, I'm coming in touch with this Beck flower remedy that all flowering and beautiful plants are used for positive healing. In Beck flower remedy, they use a lot of flower essence and floral essence to work in a certain way. Probably this is the basic fundamental knowledge which is being applied there as well. I don't know. I'm a layman. I'm just asking.
Yeah, I think the way it would be found would be the first intuition of finding the remedy would be this, what subjectively you feel about it. And then, of course, the trial will tell you whether that feeling is true or not.
True or not?
Because the trial will clearly separate the winners and the losers. But the interesting part would be how animals would see the same thing, how they would feel about the same thing. For example, I'm just giving a crude example. When you look at touch me not, do you see as something too delicate or something too proudy,
Right.
narcissistic?
Hmm.
So touch me not because I'm too delicate, or touch me not because you're not worthy of it. So we don't know how subjectively different people or different species would be looking at it, but it's an interesting thing to explore. So they have this kingdom.
Also,
Yeah,
in I think this is such a profound knowledge. Probably Sanatan and Vedic has also used, because in certain worshipping of certain god and goddesses, a specific flower or dhoop or tulsi, I think it is to do with something very fundamental and elemental in nature, which is why a certain deity is offered a certain kind of a plant.
true.
So if we see the whole spectrum of all the knowledges coexisting, there is a link to this fundamental elemental form which you're sharing right now with us.
Correct. Because this does open up very wide doors of philosophy. There's no doubt about it. Because it tells us about some sort of a design underlying what is in front of us.
Right,
And maybe this intuition is something that shamans might be using in their ceremonies for healing, whatever they use for healing.
right.
So, we,
Sir, just can we pause for a second? There is some urgency.
so similarly, they have a typology of plants and a typology of animals. And based upon what we see as the essence of some animal, essence of some plant, the core characteristic, that is thought of to be the core thing that is in the remedy. And the final thing comes out in proving whether it's true or not. And that fortunately and surprisingly works. Like it's not the opposite, or it's not something absurd or unrelated, that a touch me not plant does not produce anything strange. And the pattern, that what is felt by us when we look at it in a macro way, the same thing continues in the potentialized diluted form. That is something of a surprise. Good part is it makes things easy. That we don't have a situation where the more you potentialize and dilute, different characteristics come up. Fortunately, there is no emergence in that dilution process. Otherwise, it would be an extremely complicated thing. In that sense, it is simple that what we see in a macro way, the same thing gets potentialized in the diluted form. So these three, and like I said, all these three kingdoms are used for finding the remedy. So that when a person comes, you classify him as plant, animal, or mineral, and then look in those kind of remedies which are mineral based, plant based, because remedies are created out of all bases. Anything you can take and dilute and potentialize and try it out and see if it works. So that helps in remedy selection. All the three kingdoms.
So that brings us to a philosophical difference between psychoanalysis and homeopathy. How we go about it.
Philosophically, there are agreements and differences. The concept of life energy or vital force is the same. The concept of many sicknesses somatizing out of psychological issues is the same. The concept of aggravation before healing is the same. The concept of going back into reverse when we start the healing process, that also by and large is the same. Where the differences are is psychoanalysis is largely based on a materialist philosophy. Hahnemann was never so adamant like Freud was on a materialistic philosophy. The idea of life and death instincts is not there. Although we talk of derangement of the life force, vital force, but we don't go into a separate force which deranges the vital force. We don't talk of the death instinct. That's a difference. The modality of healing, of course, is different. In psychology, we are largely involved only with the mind. In homeopathy, it is mind and body both. So that's a difference. The healing using pills, whereas in psychotherapy, it's largely therapy. That's a very big difference. There are some uh, compare contrast things. Uh, for example, let's take the idea of miasms, which is encountered by everyone. Anybody in the process of healing will encounter situations where you have a patient, you start the healing process, the healing continues and then stops. And then you are up against a brick wall, nothing will move. That so far and no further. This is encountered by all healers in all pathies. Let us say we are dealing with a dependent personality disorder and we get into therapy and the healing proceeds and then stops at a particular point and will not move ahead. That will be encountered by a psychotherapist. And if the same patient or similar patient goes to homeopathy, he will also encounter this. When he encounters the difficulty, he will call it a miasm. That the constitutional medication has taken the person so far, is not taking him any further. So what he will do is, he will go for the miasmatic medication for some time and again come back to the constitutional medication. Now, how would we look at the miasm? And that's very interesting. We will say that there was an early life object loss which led to this dependent personality disorder, and that traumatic event of the early life object loss, which I use the valley junction model, that the man is traveling on the road very happy and then the traumatic event happens, and from the road the man falls into the valley, and in the valley there is an unbearable psychological state, high anxiety, high aggression, high paranoia, high guilt, high shame, very high I am not good enough, I am powerless, I am helpless, and the whole situation is unbearable. And there is no way the person can jump from the valley onto the road back again. So he has no choice but to jump to the mountain top. And when he jumps to the mountain top, he becomes a narcissistic person. If he feels that I can reach the mountain top by identifying with somebody who is omnipotent, he becomes a dependent. So anyway he goes, the narcissist is standing on the mountain top. The dependent is balancing his being in the valley by identifying with somebody on the mountain top and somehow getting on the road or very near to the road, just a few feet below the road, but stabilizing himself there. Now, in both cases, healing proceeds and then stops because we are at the traumatic event. Now, is it that the core traumatic event of the early life, which is at the core of the whole pathology? You can look at the root. If you think the metaphor of a plant, the root, the trunk, the branches, the leaves. So from the leaves, many manifestations of the leaves, very small symptoms. You heal them and you come to the branch. You heal the branch, you come to the trunk. You heal the trunk and you reach the roots. And now there is a stalemate. Because you are at the most difficult place where unless the valley is filled up, the man cannot leave the mountain top or identifying somebody on the mountain top. And the filling of the valley is internalizing a good, reliable, stable object. And because of the early life traumatic event, the process of internalization is inhibited. So the need is to internalize a good, reliable, stable object to fill up the valley and come back on the normal road. But because of the early experience, the internalization is inhibited. So the man stabilizes the situation only by the presence of the omnipotent till the person is present, and for some time after he leaves. But after a gap, he again needs the physical presence of the other person. So now we would call it the difficult part of healing the core event, which cannot happen without filling up the valley, which cannot happen without safety, which will allow the person to internalize a good, reliable, stable object. And the homeopath possibly would call it a miasmic stalemate. So the question is, the core psychological traumatic event, is it that what they are calling the miasm? Or is miasm something constitutional which is leading to this core traumatic event? You can go into definitions as far as below as you want to go. You can keep asking why this, why this, why this. At some elemental level, you say this is miasmatic. And there is no further why to this. That may be one way to look at it. That one way to look at it is that what we call the core traumatic event is the miasm of homeopathy. Second way to look at it would be miasm is what leads to the core traumatic event. Third way to look at it would be that the death instinct is what leads to the miasm, and the miasm leads to the core traumatic event. So fundamental to miasm then would be Freud's death instinct. So various.
Does that mean the first one you're talking was that there is a continuum till which the life force acts upon, and then it surrenders to the death instinct? That is the a place, a spot where an individual can flip the life force.
Correct. That is what happens in the trauma. That in many cases the death instinct overtakes the life instinct, if you analyze in that model. And that is what happens
Even with small t's, even with the small traumas.
And that is what happens in the aging of the person. That as you age, the power of the life force reduces and the power of the death force increases. And when the death...
Ideally should be the other way.
Yeah. How?
If the individuation has taken place, it should... I'm talking about the psychological life force, not the constitutional life force.
So
there is more understanding, less vulnerability, less dependency as you grow.
Correct. So the effect of the power of the death instinct over the mind reduces if you have worked over yourself. If you are not worked on yourself, then you become more depressed, more hopeless as you age.
Right.
But on the body, the effect is very clear. That as you age, the power of the life force reduces and the power of the death force increases. In homeopathic language, you would say the power of the vital force reduces and the power of those forces which derange the vital force, that increases. So that is a very interesting way of looking at it, that philosophically these when we look at the two, compare, contrast. And one way important element here is that if we could reliably and gently cure psychological sicknesses with homeopathy, then psychotherapy should be used only for those cases where it is not working. Because in terms of cost, ease, and the gentleness, homeopathy is a much better method than psychotherapy. Because in psychotherapy, the cost is high, the time is high, and you have to go through your difficult feelings. Now, the good part is it results in one's self-growth, which may not necessarily happen in a non-therapeutic homeopathic method or allopathic method. That's a separate part. But if one does not look at the growth aspect of therapy, only looks at the problem-solving aspect of therapy, then this becomes a much cheaper, easier, quicker method. So all these are prospects and problems and the intermingling of strengths and weaknesses of different things.
Does what you say that also means that if there are personality disorders, not disorders, personality pathology, small trace and traces of that, psychotherapy would be more ideal.
Right. In terms of the personality disorders, but homeopathy would be a great help. Let us say somebody cannot afford, or somebody does not have the intellectual finesse, or somebody cannot bear the feelings coming up. Then for them, homeopathy will be a very good thing. And for others also, I mean, in one sense, it can be the cheapest method. It can be the most gentle method. It can be the most non-intrusive method. It may be the most do-it-yourself method. And it may be the quickest method. So if the promise was to be fulfilled, it would be the best method. The fact that other methods exist and people still seek something out of homeopathy is because the promises are not fulfilled. And the whole question there is the number of remedies that you have and the selection of the remedy and the handling of aggravation and the knowing, therefore, of how it works. Until that is known, of course, it will be a heuristic method. So,
So when we talk,
please go on.
see, no,
Please.
I was just going for another question. You can just add on to the point you were mentioning.
1 minute to go. Should we take the next question in the second part and the coming part?
Third part? Sure, sir.